Today, on World AIDS Day, the United Nations is calling for easier access to life-saving medication for all people. According to the UN, this is the only way to achieve the goal of ending the pandemic once and for all. The latest figures from the UN program UNAIDS show that 39.9 million people worldwide were living with HIV last year, roughly the same number as in the previous year. The number of new infections stood at 1.3 million. This is an all-time low, but experts say that the numbers are only going down very slowly. And UNAIDS has expressed concern that in at least 28 countries, the number of new HIV infections was on the rise last year. Christine Stegling is a Deputy Executive Director for UNAIDS. She joins us now from Hamburg. Welcome to DW. Before we analyze the challenges of the global fight against this disease, what developments make you hopeful for the future?
Yes, thank you for having me. Many things make me hopeful, even the figures you just showed. You know, in 1996, we had about 3.3 million people getting newly infected with HIV each year, and now we have 1.3 million. So we have come a long way preventing new infections. A few years ago, in 2004, we had over 2 million people dying of AIDS-related death or AIDS-related diseases every year. And now we have just over 600,000 people dying. So we are on the right path. We know that we know what to do to prevent new infections. We know what success looks like. And we have also new technologies. We have new prevention technologies. We have in the pipeline an injectable pre-exposure prophylaxis, which means possibly very soon we could just inject people twice a year and prevent new infections. And so we have lots of good things coming our way and that are happening. We just need to stay on that path and follow that path.
Over the years, we've all been learning it's now possible to live a good life with HIV when using the right drugs. According to your latest report, though, almost 10 million people don't have access to them. Why is that?
Yeah, why is that? And, you know, it is really a tragedy that we have the right medicines. We know that people can live a very fulfilling and almost, a life like anybody else. And still to this day, about a quarter of people do not have access to that treatment. So a lot of it has to do with people not being aware of their status. So we are still, in some communities, have low rates of testing. So people don't know that they need treatment. We still have communities that do not come forward to health facilities to get the treatment, or they don't stay on treatment. And a lot of that has to do with stigma and discrimination that is still attached to HIV. And that is why today on World AIDS Day, our report that we just launched last week is focusing on the protection of human rights, because we're saying you need to protect human rights. You need to ensure an environment where people are not fearful, where they come forward to the services that are life-saving or that avoid new infections because they feel safe and comfortable.
You've touched on this a little bit, but I want to go a little bit deeper. Why are there so many countries where infection rates are rising, especially among girls and young women?
So girls and young women, or how we call it, adolescent girls and young women, are especially prone to new infections in sub-Saharan Africa. So we have 4,000 new infections in adolescent girls and young women in the world every week, and 3,100 of those new infections are in Africa. And a lot of that has to do with gender inequality, gender-based violence, and the status of young girls in communities. We know that when young girls finish secondary school education, their likelihood of teenage pregnancy and their likelihood of getting infected with HIV reduces substantially. So we need to look at HIV not as a medical problem, but really as a problem that touches the socioeconomic, the political context in which people exist. And for adolescent girls and young women, it's important that they finish secondary education, that they are safe, that they're economically independent, that they have agency for their life, to enable them to avoid getting infected with HIV.
Our sincere thanks to Christine Stegling, Deputy Executive Director at UNAIDS.
Thank you so much.